I'm Dr. Lisa with Private Practice Made Easy, Your Turn to Lead. And in this video, I'm going to break down 7 key factors based on your clinical and business needs in regards to choosing the right EMR or electronic medical record. This is one of the most important decisions that you are going to make when launching your private practice. All right, so number 1, identify your practice needs. So this is going to include, what is your niche? What is your specialty? What is your target audience? Are you just doing pediatrics? Are you doing mental health, psychiatry, primary care, aesthetics? There are EMRs specific for your specialty. So you want to look at 2 or 3, get demos, and ask a lot of questions before you make your decision. Also, do you need telehealth integration? Most of us do, so make sure that that has the capacity, or you can use something like Zoom with HIPAA compliance, the business, should I say, Zoom, with the HIPAA compliance integration if you want. But it's nice to have everything built into one system. Also, are you cash pay or are you billing insurance? Some EMRs will only allow you to bill for private pay. But if you're doing insurance, you want to make sure that you have that capacity with clearinghouses, okay? Very important. How many providers or users will you use in the system? Because for each provider, most EMRs are going to charge you for each provider, which can be very costly if you go from a private practice to a group practice. The other thing you want to consider for nurse practitioners and PAs is that you have a supervising MD or a supervising physician, and so they have to have access. And that can range from $30 for them to have access to $200 a month. So again, that can be costly, especially if you're having a group practice and you have many NPs or PAs that have supervisors. So that means you would have to purchase a spot for your provider, and then you would have to purchase a spot for their supervising PA, okay, or supervising physician. So that can really add up. So keep that in consideration if you're going to scale from a private practice to a group practice. And then, do you need e-prescribing? If you're a therapist, then you don't need e-prescribing. Do you need lab integration? If you're a therapist, you don't need lab integration. And then another thing that you want to look at is, do they have the ability to custom your template? Because there's a lot of great templates in these EMRs, but you might have your own customized template that you want to integrate. So just these are questions that you're going to bring into your demo. And when you ask questions to the salesperson of the EMR company. Number 2, define your budget. This is very costly. As I said, each type of integration into the EMR can be like a la carte, so that can add up, and each provider, that can add up. So understand what your budget is for your EMR. What's the monthly cost for you? Or if you're going to a group practice, what's the monthly cost per each provider? Is there a setup fee or an annual contract? I would recommend, if you can do an EMR without a contract, that is great, especially in the beginning. Now, once you get started, that's fine, but what if you get in the EMR and you find it just too complex and then you don't like it? So, then you're stuck. So be careful with the contract. Are there add-on fees for billing, telehealth, e-fax, or patient messaging, or even having a patient portal? Like some of these EMRs, they'll add everything. You have your base pay your setup fee and then your base monthly fee, and then they'll add on e-prescription, they'll add on your supervising MD, they'll add on labs, they'll add on fax, they'll add on patient messengers. Oh my gosh, by the time you finish, you're at $500. So think about that when you're doing your demo. What are the costs for add-ons, or is it all inclusive? Number 3, prioritize key features, okay? So there's common features to consider. That would be HIPAA compliance, which you really don't have to worry about anymore. All the EMRs are HIPAA compliant now. What are your must-haves? Is it e-prescribing, including if you're prescribing controlled substances? Can you write controlled substances through the e-prescribing? Do you need telehealth? What about appointment scheduling? One thing that I would really, especially in today's time, is I would prioritize AI. If they have AI integrated for your documentation, oh my gosh, that's going to be such a benefit, because you know how much time goes into documenting. And if a lot of them have voice recognition, so they can be there right there when you're patient, they can listen, and then it types your note. It does all your documentation. It's amazing. Saves you so much time, and then you can really be engaged with the patient. Another must-have might be your patient portal and the patient being able to self-schedule. In another video, I'm going to talk about AI agents and being able to use them for your scheduling, but you also want your patient to be able to schedule as well. You want to have some patient engagement with the EMR. The other thing that might be a must-have is mobile access. So everybody's on their mobile now. So you want to make sure that there is an app of some sort for your patients. Analyticals and reporting is so important. Keeping data, tracking data, letting it have daily, monthly, quarterly, annually reports is invaluable. It really is. I can see also in my EMR, it'll break down my patients, like the medication, like controlled substances. How many controlled substances am I prescribing a week, a month, a quarter? How many patients do I have on Suboxone in my MAT program? How many patients did I see this month? Just so much with the analytical. So when you're doing your demo, be sure to go over the reporting and analytics. So you can, which is really helpful for tracking growth and scaling. And of course, we talked about integrated billing or clearinghouse, which if you're taking insurance, you want that integrated as well. You're looking for ways to reduce manual work. You're looking for ways to autopilot things. All right, so number 4, let's compare top EMRs for small practices. So the one that is really popular in mental health and therapy is SimplePractice. It's for behavioral health. It is pretty simple, should I say. It's easy to use. They have telehealth. The cons is that it limits medical billing options, so you have to look at the cons with that. Another one is Theranest, which is for mental health. There is Cairo for small practices. There are DrChrono, Advanced MD. Advanced MD is really good for scaling practices. So if you're going to scale, that's a really good one. If you are a psychiatry and maybe substance use and therapy model and you're a group practice, Valent is very sophisticated. It's a little costly, but it's very sophisticated. If you want to go with something very If you're a wellness practice and very cost effective, there might be Healthy. Healthy is an EMR. It's not complex. There are limited features, although they just added like e-prescribe. You can't do labs, I don't think, from there, but it does have Recopia integrated, which is an e-prescribe. So you want to compare EMRs. Like I said, at least 3. Actually, I said 2 to 3, but really you need to look at least 3 EMRs and do demos and ask questions. This is just a really important part of the decision process when you are launching your business. Number 5, we've kind of gone over, request demos, but I want to add something to this. Free trials. Get a free trial. Schedule 2 to 3 demos, and then ask them if you can have a 30-day demo. Ask them, can I create templates for my progress notes? Ask them, how do I prescribe Schedule 2 medications? Ask them, what's the onboarding process, the implementation period? I want that part of the free trial. Can I migrate my patient records from my current system? That's huge. So if you are already in a private practice and you're scaling, you want to go to another EMR. That's why it's so important. You don't want to keep changing because you have to do that integrative process. When you get an EMR, they kind of got you, because trying to transfer your patients over when you have 1,000 patients it's a lot. So get your demos in and get a free trial. All right, moving on to number 6, evaluate support and training. Do they offer live support, or is it only chat on email? Now, a lot of systems are you can't talk to anyone. There's no live support, or there's just AI. So if you're one of those people that, hey, I need to pick up the phone and talk to someone, then you want to ask those questions, because everyone's going to email or a chat, and some EMRs don't have a number that you can even call. So be careful with that. Are training materials provided? So is there a library of training materials so I can go there to reference something that I'm doing? Is there an account manager or onboarding specialist? Most of them have an assessment and implementation phase where you'll have an onboarding specialist, which is really nice because you have a contact person that you can ask questions. So demo, trial, onboarding specialist, really important. All right, last but not least is number 7, check reviews and peer feedback. So there is software advice, G2, Capterra, I believe it is, and look at Google's reviews. Ask your peers, or look at the Google reviews for the EMRs, and there are a lot of Facebook groups for NPs, PAs, for therapists. Go there, ask them what are you using, what EMRs are you using, and what are the pros and cons. So choosing your EMR is very important. I hope these 7 factors have helped you in considering choosing your EMR.